Now I am going to introduce Associate Professor Dr. Hüseyin Akıllı. He is from Turkey, Başkent University from Ankara. He is a brilliant, young, new gyne-oncologist. He is going to present cervical cancer Turkey data. Floor is yours.
Thank you, dear chairs, dear colleagues. Thank you, Dr. Kush. I'm very honored, presented by you. And first of all, I want to thank the organizing committee, and I want to emphasize that I'm very proud to be part of this MEMAGO family. And I'm going to present you now the data, the real-world data about cervical cancer in Turkey. So I have nothing to disclose. First of all, before starting, I want to thank my colleagues who worked with me in this project, and this project was led by Professor Mutlu Meydanlı and Professor Ayhan, who are some of the founders of MEMAGO. And first of all, Turkey has started the screening program with HPV DNA in 2014, and about vaccination, the target population is between the age of 9 and 45, and we have 4.7 billion of patients to vaccinate, people, not patients, to vaccinate. And by far, we have vaccinated 400,000 people, and now it represents less than 1% of our population. The aim is to vaccinate 90% of this population, by the way. And cervical cancer is the 10th most common cause of cancer among women in Turkey, according to Ministry of Health data, and according to Globecan data, it's 12th most common cancer, and you know that the reliability of Globecan data is questionable, especially in our region. And the aim of the study is to determine the burden of cervical cancer and the rough 3 years overall survival rate of these patients. And the database of Turkish Ministry of Health was searched in order to identify all consecutive cervical cancer patients during the year of 2019, and we tried to give 3-year overall survival, and the study was retrospective, nationwide cohort study. And during this study period, we examined 658,000 women who were screened for cervical cancer, and we diagnosed that 2,539 new cervical cancer patients. And the median age was 53, ranged from 20 to 94, which is very interesting. If you look at the distribution of the patients according to the hospitals, you can see that most of the patients are diagnosed and treated in government hospitals, which was 42%, and show us actually the government policy is very good according to diagnose and treat cervical cancer. And you can see the university hospitals and private hospitals, which is not very low. And we had 12% of patients had HPV testing during diagnosis, and we saw that 6% of the patients were HPV negative. As we can compare with literature, it's like 5% of patients of cervical cancer were independent of HPV virus. So, before treating, when we look at the cervical biopsies, you can see the 8.4% of the patients were negative for cervical carcinoma or had pre-invasive lesions. And most of the patients have diagnosed as cancer before treatment. And then about the histology, as you can see, the squamous cell carcinoma accounts for most of the cancers than adenocarcinoma and adenosquamous cell carcinoma. About the procedures, so most of the patients underwent radical hysterectomy, and you can see that 17 patients, which is accounts for 1% of the patients, were undergone trachelectomy in terms of fertility sparing surgery, and 1.4 patients underwent pelvic exenteration due to stage 4 A disease at the time of diagnosis. It's very important, and it shows us that it's the diagnosis is in very late stage, and lymphadenectomy was performed 75% of the patients. So when we look at the route of the surgery, most of the patients underwent laparotomy, and you can see 62 patients, which was 6.1% of the patients underwent laparoscopy, and 1 patient underwent robotic hysterectomy in 2019. So 41% of the patients were staged as stage 1, and 26% of the patients staged as stage 3. And as primary treatment, half of the patients received chemoradiation and half of the patients underwent surgery. And after that, adjuvant treatment, when we look at adjuvant treatment, nearly, again, half of the patients received chemoradiation and radiation alone. And the aim of the study was 3-year overall survival. And if we look for stage 1 disease, stage 1A, 1A2 is excellent survivals, but do not forget, these are not disease-specific survivals. These are rough overall survivals. So, and you can see in stage 3 it's about 60%, and for stage 4A it's 40%, and stage 4B it's like 28% 3-year overall survival. And in conclusion, so in spite of 10 years of experience for nation-based HPV DNA cervical cancer screening program, cervical cancer still seems to represent an important tumor burden in Turkey, and we need to do more about preventing cervical cancer. And thank you very much for listening to me.